In this video, we will discuss the classification and mechanism of action of antiarrhythmic agents. For a better understanding, it is recommended to watch the videos on cardiac action potential and tachyarrhythmias. According to Vaughan-Williams classification, antiarrhythmic agents are classified into 4 classes. Class 1 drugs are sodium channel blockers. It's subdivided into 1A, 1B, and 1C. Class 1A drugs are quinidine, procainamide, and disopyramide. Class 1B drugs are mexiletine, phenytoin, and lidocaine. Class 1C drugs are econide, and propafenone. Class 2 drugs are beta-adrenergic receptor blocking agents. The drugs in this class are propanolol, esmolol, and metoprolol. Class 3 drugs are potassium channel blockers like amiodarone, sotalol, ibutylide, and dofetilide. It should be noted that sotalol is also a beta blocker. Class 3 drugs also have class 1, 2, and 4 properties. Class 4 drugs are calcium channel blockers. Verapamil and diltiazem belong to this class. Let's discuss the mechanism of action of individual classes of drugs. Class 1 drugs are fast sodium channel blockers. Class 1A drugs are moderate sodium channel blocker. It moderately decreases the phase 0 slope of cardiomyocytes' action potential. It increases the action potential duration and effective refractory period. Class 1B drugs are weak sodium channel blocker. It minimally decreases the phase 0 slope. It decreases the action potential duration and effective refractory period. Class 1C drugs are potent sodium channel blocker. It markedly decreases the phase 0 slope. But there is no change in action potential duration and effective refractory period. Class 2 drugs, which are beta-adrenergic blockers, acts by blocking the sympathetic activity. It also decreases the slope of phase 4 of SA nodal action potential. It increases the effective refractory period of AV node. Class 3 drugs, that is the potassium channel blockers, act by prolonging the repolarization that is phase 3. Thus it increases the action potential duration and effective refractory period. These drugs also have class 1, 2 and 4 properties. Class 4 drugs that are L-type calcium channel blockers, as shown in the picture. Decreases the phase 4 slope of SA nodal action potential and increases the effective refractory period of AV node, similar to the action of class 2 drugs. Let's see each class of drugs and how it acts on the different mechanisms and types of arrhythmias. Class 1 drugs decrease the slope of phase 0 in cardiomyocytes. So suppresses the ectopic pacemaker and triggered activities. Class 1A drugs can be used to treat supraventricular arrhythmias like premature atrial complexes, atrial flutter, and atrial fibrillation. It has a limited role in prevention of ventricular tachycardia and ventricular fibrillation. Class 1B drug lidocaine is useful only in ventricular arrhythmias. It is not useful for supraventricular tachycardias. The only drug in class 1B used to treat SVT is phenytoin, that too only for digoxin-induced SVT. Phenytoin is also used to treat ventricular arrhythmias due to digoxin toxicity. Class 1C drugs are useful to treat both SVT and ventricular tachyarrhythmias. Class 2 drugs that are beta blockers, blocks sympathetic activity and decrease SA nodal phase 4 depolarization. Thus it decreases enhanced automaticity and triggered activities. It also increases effective refractory period of AV node, thus it abolishes AV nodal reentrant tachycardia. Beta blockers are used to treat both supraventricular and ventricular tachycardias. In SVT it is used to control ventricular rate. Class 3 drugs increase the effective refractory period of the action potential. Thus it abolished reentrant circuits. Since they also have class 1, 2 and 4 properties, they are used to treat a wide range of SVT and ventricular tachyarrhythmias. Class 4 drugs mainly increase the effective refractory period of AV node. Thus it abolishes reentrant circuits and controls the ventricular rate in SVT. Calcium channel blockers are usually not used to treat ventricular tachyarrhythmias. Class 5 drugs include other drugs like adenosine, digoxin, and magnesium. Adenosine opens the potassium channel, causing membrane hyperpolarization. It is used to treat paroxysmal supraventricular tachycardia. Antiarrhythmic action of digoxin is mainly due to central and peripheral increase in the vagal tone. Thus it controls ventricular rate in SVT. Magnesium is used to treat drug-related torsades de pointes and digoxin-induced ventricular tachycardia. Hope this video was helpful and useful. If you enjoyed this video, like, share and subscribe. Thank you.